Welcome to Window to China. I'm pleased to welcome an acupuncturist, Besty Golem, on my show today. Can you introduce yourself?
My name is Besty Golem. I am the owner of Meridian Healing Works Acupuncture in Falls Church, Virginia. I have been practicing acupuncture about 15 years now, and I went to school in Maryland. All my teachers were Chinese practitioners and had come from China. So I also studied Chinese herbal medicine at a school in Laurel, and so after some time, this is what I do.
Wow, can you speak Chinese?
No, I can't speak Chinese.
Okay.
You know, I can speak certain words, you know,
okay.
like for herbal.
For example, like energy?
Energy, qi.
Oh, wonderful.
Yes.
What makes you become an acupuncturist?
Well, my first degree was in music. I studied vocal music, operatic singing, and I worked at a music store in Falls Church for many years, but I realized that there was not much advancement in the company, and I was interested in health and healing, and so I started thinking about finding another career. And I went to a number of open houses. I thought about becoming a chiropractor. I thought about becoming a massage therapist. And then I went to an open house for the acupuncture school. And I was very intrigued. And at the time, I'd been having migraine headaches every weekend for about 2 years. I'd get a migraine headache that would completely lay me out for the whole weekend. And I decided to try it. And 8 treatments later, I had no more migraine headaches. So that was fairly interesting to me, and my chiropractor at the time encouraged me to try the school, and I was a little apprehensive because I was working full-time and I wasn't sure how I was going to fit it into my schedule, but I eventually did it, and 15 years later, here I am.
Oh,
licensed acupuncturist with the state of Virginia. So.
Wow. So you were healed by your own headache. You have this experience.
Yeah.
But how does acupuncture work for people? I mean, how does it work?
How does it work? Well, we consider that when we insert an acupuncture needle into a point on the meridian, there are 16 major meridians on the body that correspond to our internal organs. And when we insert a needle, it's basically we consider that it encourages the body to come back to its own harmony of health and healing. Basically what acupuncture is doing is it's encouraging our own healing systems, our internal healing systems to strengthen and come back online, basically, you know, if we think about it like a computer. But basically, it's we're helping the body relearn how to heal itself. Because we all, you know, the body, if we cut ourselves, a cut will heal on its own, you know, develops a scab, and then it develops a little scar, and then it, you know, the skin regrows. And so it's the same with acupuncture. You know, our bodies have amazing healing mechanisms at their disposal. So acupuncture and Chinese herbal medicine, by extension, also help with those, help encourage the body to heal itself.
Do you apply for the Chinese medicine at the same time with acupuncture or separately? I mean, the Chinese medicine as the when you do acupuncture, do you some situation you need to apply for Chinese medicine at the same time?
Oh, herbal medicine?
Yeah.
I will use often the same. I mean, I will use them together. I'll often give someone an acupuncture treatment. The acupuncture treatments, on average, they'll help the person for maybe a day or 2 or 3. But if I supplement with Chinese herbal remedies, then that helps to supplement the acupuncture treatment. So then the patient is getting even longer effect with the herbal medicine. So I often will use them simultaneously.
In your website, you said acupuncture is a healing system. It's not a belief system. What does that mean?
Well, like I said, that the acupuncture is able to reboot essentially the person's own healing mechanisms. You know, sometimes people will say to me, well, I don't believe in acupuncture. Well, you know, they have used it with animals. To treat animals, they started with actually horses, with race horses, to treat ailments that horses were having pain, or you know, if they were having problems with their gait, then they would treat horses. But they've also now used it with cats and dogs, and one of my professors actually used it on a tropical fish. And it helped the tropical fish. The tropical fish was laying on its side, and the woman's neighbor, came and said, "Please, you have to help my fish." And so she put an acupuncture needle in the fish, and it came back up to, you know, to its right size. So, but animals don't know whether to believe in acupuncture or not believe in acupuncture, but often animals, after having an acupuncture treatment, say if they have arthritic joints or they have trouble walking after an acupuncture session, the animals will jump off the table and they will be, you know, so that speaks to the acupuncture stimulating their own healing mechanism.
But if it as acupuncturists works for their own healing system, what is your role in someone's healing journey?
Well, I consider myself a partner with my patients. Not that I'm the healer and they're just letting themselves open to me. I consider it a partnership, that I'm working with the person to help heal themselves, because often, you know, we consider healing as a journey. You know, when we have some particular ailment, whether it be a cold or insomnia or cancer even, you know, there is something that's gone out of balance in the system for the person's healing mechanisms. So I consider my job to help encourage the person's healing mechanisms to increase and to come back online, like I said. So I consider it a partnership.
I know acupuncture can heal many ailments. What is the situation does it work very well? What situation doesn't work very well?
Well, you know, it depends on the person, and it depends on the person's age and how long the person has had a particular dis-ease or ailment. I often find that pain conditions respond quite well to acupuncture, you know, whether it be if someone gets headaches, or if they have shoulder pain, or if they have low back pain, or if they have neck pain. I treat quite a number of people for those types of ailments, for neck pain, shoulder pain, low back pain. You know, those are typical ailments that people come to me for, and they respond quite often. I find after 5 or 6 treatments, you know, that the people are having much less pain, much less intensity of pain. They recover more quickly from if they have a pain episode, their recovery time is much increased. So that responds quite well. Some things that maybe take a little longer might be something like insomnia or something like cancer. You know, I do, but you know, when I'm working to help someone heal from cancer, I'm often working in conjunction with Western doctors, because you know, the person is very often, they've gone through chemotherapy or they've gone through surgery. So you know, so I'm helping the person heal with the effects of those types of therapies. So that is a more long range type of healing mechanism, you know, a healing system.
Yeah.
So pain responds quite well. Also headaches respond quite well, like myself. You know, after 8 treatments, I had no more headaches. And oftentimes I find I like to treat if people have gastrointestinal types of ailments, like, you know, often people have IBS, irritable bowel syndrome. So it helps with a lot of digestive problems, or people who they feel nausea a lot. It helps with nausea. I work with women who are pregnant, and they have morning sickness, and so often the acupuncture helps to relieve nausea. So those are a few things that it's very good to help with. Also, I like to work with allergies. You know, if people have allergies or colds or flu, acupuncture is very effective with that, for opening the sinuses, for encouraging, you know, effective nasal passages to be open. And
can you tell me a little bit detail how you can tell the differences of the allergies?
How do I tell the differences?
Yeah. What kind of allergy they are?
Well, I mean, people come to me for spring and fall allergies. I mean, those are the usual times when I'm treating people. But, you know, sometimes people might be allergic to their cats or their dogs, or they might be allergic to dust.
So what are the different strategies you apply for the different system?
Well, you know, I analyze, when a person comes to me, I analyze their particular body. I ask them a lot of questions about their health history. You know, some of the acupuncture points can be used from one person to the next, but then some people, depending on their particular constitution, how their particular body works, because everyone is different, I might use specific points that help reduce more sort of, if a person has more crusty type of nasal discharges, or as opposed to somebody has really drippy sinuses. You know, I differentiate. So I'll ask them questions about those types of things. You know, I'll ask, do you have drippy nasal discharge? Do you have crusty nasal discharge? Is it clear? Is it yellow? Because all of those things indicate to me certain things about how that person's body is functioning, how that person's qi is flowing. You know, when we talk about qi.
Yeah, that's qi is the core. What that term? Yes.
Qi is roughly defined as energy. Qi really is all around us. Qi is inside the body, it's outside the body. Qi, we consider it in some ways like a vibration. You know, we have vibrational energy, like lights are vibratory, or sound is a vibration. We also consider that qi is like a vibration also. So if the qi is not vibrating through our bodies efficiently enough, then we might get things like headaches, or we might get things like sinus congestion. So the acupuncture needles, often with allergies, I will often put needles here beside the nose. I might put a needle here between the eyebrows. I might also put needles on the hands and the feet, because all of those acupuncture points, they help to encourage the sinuses to be open, and to help encourage for not too much discharge, not too much runny nose. Or a lot of people will get post-nasal drip, so they'll get drippiness down their throats. Sometimes it might be thick and the person is like coughing all the time to clear it out. You know, I find that. Or sometimes people are just constantly like swallowing because they have this drippy post-nasal drip. So I might do points on their legs, because some of the points encourage for more free flow of those types of fluids, or to encourage the body to eliminate those fluids, whether that be through their urine or through their feces, as opposed to it getting stuck up here in the sinuses.
Yeah, I know. So acupuncture can help like qi go flow in the body system. So can I see this is the healing systems, is healing process, is the nature connection with qi, or with like wind, water, everything, like lights around us. That's correct?
Yeah, I mean, we consider that, yes, qi flows through water, qi flows through the earth, qi flows through even this table here, qi flows through metal. So, and we consider that our bodies are like a microcosm of the cosmos, if you will. You know, the world, the cosmos is the macrocosm. So we metaphorically we consider that we are affected by nature. So we might be affected by wind. We might be affected by damp weather, like if it rains or if it's particularly snowy. Oftentimes, my people with arthritis, they will come in and they will say, "Oh, I knew a front was coming in. I knew it was going to be rainy weather because my joints started aching." So metaphorically, we would say that there has been dampness. We call it dampness, or excess fluids have collected in the joints. So that's metaphorically how we're being affected by nature.
I have one question. Is acupuncture definitely have to some professional people do it, or just anyone they have some knowledge they can do it?
Yeah, all acupuncturists in the state and across the country actually have to have graduated from at least a 3 or 4 year institution, which I did. And we have to pass also a national board examination, like doctors pass a board examination. Also, acupuncturists must pass a board examination to be licensed. There are also other types of tests that we have to pass. One of them is called the clean needle technique test, so that so that we insert the needles with a septic, in a septic way, so that we're not contaminating the needles before we insert them in the patient. Yes, and then everyone has to apply for a license. So every acupuncturist in the state is licensed by the State Medical Board of Virginia. So that's a requirement.
The reason I ask you because I have a personal experience. In one summer, I was sick. My mom just insert, needles into my fingers, 10 fingers. Then it's comes out to the, bleeding.
Right.
But seems like just a few, I think few hours, I just feel immediately get better. So it's get back the energy.
Right.
Do you think why it works?
Well, in China we find
probably in China it's different. What's in US?
It's a little different only because Chinese medicine is at least 5,000 years old. So Chinese medicine has been, the tradition. It's passed down from father to son,
right.
And et cetera, or it's passed down from the master to his student. That student becomes the master. He passes it to his student. But a lot of times, people in the outer lying villages, they didn't have access to an acupuncturist. So they practice and you probably know this, what they consider as barefoot acupuncture.
Right, it's called 赤脚医生 in Chinese.
Acupuncture, yeah.
Right.
So, a barefoot acupuncturist is someone who has some knowledge of acupuncture and where the meridians flow, and so they are able to use acupuncture needles for certain types of ailments. So I would say most people in China have some knowledge of this, and so like yourself, and there are certain remedies, certain things that you can do fairly easily. To remedy certain ailments.
Actually, I tell you the truth, I was scared of the needles, but it seems okay. Is it dangerous?
No. Acupuncture needles are not dangerous. They're actually they're quite fine. They're almost the size of a hair. Some of them. They're different than hypodermic needles that we find with. If you have blood drawn or if you're given an injection for something, those particular needles we can refer to them by gauge. They have a larger, hypodermic needles have a larger gauge, a hypodermic needle might be a gauge 18, which is quite large, whereas an acupuncture needle is a gauge 38 or a gauge 40, which is quite small. Acupuncture needles also they don't have a hollow center. If you have blood taken or if you're given an injection, they have to have a hollow center to the needle for the fluid to flow down through. But acupuncture needles are solid and they come to a fine tip, whereas the hypodermic needles, they have sort of a cutting edge if you were to look at them under a microscope. So they often will be a little more painful when they're inserted. Whereas acupuncture needles, oftentimes people, they'll say to me, oh, I didn't even feel you inserting them. I don't feel anything, because they're quite fine and they come to that single tip. So they're, and when I put the needle in, I gently tap the needle in place, and oftentimes people don't even feel it. And even when I gently manipulate the needle, I might twist the needle just slightly, people say, oh, I don't even feel that.
So it wouldn't hurt anyone at all?
No, not really. Sometimes after I withdraw the needle, sometimes people might get a small, very tiny, tiny drop of blood, once the needle is removed, but that's not really often. That's sort of rare for that to occur. Sometimes on different parts of the body where there's less muscle, like on the face or on the hands or on the feet, there might be a little more chance of having a little small drop of blood come out after I've taken the needles out. But oftentimes it's not really that common. So, the only types of side effects that we find from acupuncture might be a small amount of, like I said, a tiny drop of blood coming out, or a little bruising, after the needle has been taken out. But I find that generally it's, that's rare. Sometimes we're trained for if the needle were to break off, after it's gone into the patient. Say if I put the needle in, and then while the person is lying with the needles, maybe if they move around or something like that, sometimes if the needle might break off. But in 15 years, I've never actually seen a needle break off. Sometimes, I've had needles sort of bend slightly, if the person brushes them or rests their hand against them once they're in the body, they might bend slightly, but there's no danger from that, really.
So, do the patients need prepare something? For example, like I had once experience, if someone too nervous or do not have any food before take the acupuncture, that's has something happen to people? I have had experience with patients who have been quite nervous before they came for acupuncture, and people who have not eaten before acupuncture, and sometimes people might be on the verge of becoming faint, that they're on the verge of passing out. But I can often tell those patients, I'm watching people as I'm putting the needles in, and so I can see if they're on the verge of fainting. And oftentimes people will say, I don't feel so good. I'm kind of feeling nauseated. And so that's clues to me. I've been trained to know when someone is on the verge of fainting. So in those instances, if someone is starting to sort of turn a different color, if someone is on the verge of fainting, they start to, their skin color starts to change slightly. So that's cues to me that I need to take the needles out. And I do right away take the needles out because, I don't want a person becoming faint. And I often will take the needles out. I'll have the person sit up on the edge of the bed, and then I'll put their head between their knees, because that's a way to bring blood flow back to the head. So those are some of the things that could happen if someone's very nervous, or if they haven't eaten before an acupuncture treatment. So
So those are some things that could happen, but I honestly haven't had that really happen that many times. You know, it's the rare patient who comes in who is very nervous to that extent. You know, most times people will be a little apprehensive, or they'll be a little nervous. You know, but and I can tell when I'm taking the person's pulses that maybe their heartbeat is a little higher. Yeah, a little higher.
Faster.
Yeah, a little faster. So, you know, I have ways of knowing how to calm people down before I actually start putting the needles in. And oftentimes before I put the needles in, I will ask the person to take a breath. Because that sort of momentarily gets their mind off of me inserting the needle. But it's interesting, you know, people might come in nervous like that, and I'll feel their pulses being a little faster, and then I'll ask them to take a breath before I put the first needle in, and after I've tapped the needle in, I'll say, "How was that?" And oftentimes I'll go, "Is that it?" They'll go, "I didn't feel that at all." So,
yeah, it's understandable. You also, in your website, you said food is another kind of medicine. Why?
Food is a medicine. You know, in Chinese medicine, when I do the initial interview with someone, you know, I will ask people if they run more hot or more cold. You know, some people tend to like it cold in a room, or they like to have the fan moving, or some people just feel cold all the time. So they want to have the covers on all the time. So for them, I know that certain foods are going to be too warming for them, or certain foods are going to be too cold for them. So, so like salads, for some people, we wouldn't think that that they would cause any problem. But we consider that salads are quite cold for the body, especially in the wintertime. You know, in the wintertime, it's more beneficial to eat things like soups or stews or stir fries. You know, they have more warming quality. They warm us to the core. Whereas a salad, it cools us off. That's why salad greens grow in the summertime.
Window to China and Xinyu has reached out to the hundreds of Chinese community, Asian community, and American community on performance, interview in education, politics, culture, etc. It's a link for all the communities. Xinyu and Judy Wu, the publisher AC Business, are making joint efforts to promote the program on Newspaper Weekly. Window to China and Xinyu is a 30 minutes long English program. It will be available on YouTube, Facebook, Google+, AC Business News by keywords Window to China and Xinyu.